Welcome to today's webinar hosted by Prevention Plus Wellness, LLC, located here in beautiful St. Augustine, Florida. My name is Dr. Chudley Wirsch. I'm president and founder at PPW. And today's 1 hour recorded webinar is on, as you can see the topic right there, listed to the left, marijuana, vaping, that's e-cigarettes, opioid, prevention plus wellness. We're talking about these one-session programs for youth, and we'll be talking about how to implement them to young people. We have, for two of these programs, high school, middle school, elementary school versions. For one of them, we have an adolescent version as well as high-risk young men and women. So I'll be talking about all of that. Today's session is recorded. I'll send you a link. Everyone who's registered, I'll send you a 1 hour CEU certificate. And I'm also going to be sending you a PDF of these slides. So no worries. This is a sold out session, super sold out. It's one of our more popular webinar topics, although all of our topics seem to be very, very popular for people throughout the country and abroad. So welcome to all of you across the United States and other countries that are joining us today. It's fantastic to have you. I hope you're all well and safe. And this is your time. So if you have questions, if there's something I say that's not clear, please don't leave without asking that question for me to help clarify things for you. And you could do that by just finding your chat option. That's in your More heading on your toolbar, and it says three little horizontal dots, and if you point your cursor at that, you'll find chat. You can type in anything you want. Comments, questions, and all of it is welcome. Excuse me. So today's objectives, we have three of them. We're going to compare and contrast the contents to the latest version. That's a 2021 version of the marijuana, vaping, that's e-cigarette, and opioid prevention plus wellness as PPW programs for high school, middle school, elementary school, and opioid also comes in high-risk young men and women. We're going to examine the scripts, the PowerPoint slides for providing these programs to young people in person, as well as online, one-on-one, or in a group. Lastly, we're going to review the built-in evaluation tools that come with your programs. Well, I shouldn't say all, most of our Prevention Plus Wellness programs come with a manual with your scripts to provide them to youth, either individually or in a group, and a digital download of all your reproducible materials and your PowerPoint slides for presenting your lesson. Very easy to present these lessons. Most Prevention Plus Wellness programs are just a single session, so you could really have a public health reach and reach almost all youth, if not all youth and young adults, when you use Prevention Plus Wellness programs, even during the pandemic, because you could easily provide these online. So we'll be looking at the built-in evaluation tools, training opportunities, all that good stuff today. So let's jump right into it. Here's our marijuana PPW program. This is a shot of the covers of each of these. On the left, you've got the blue high school version. In the middle school version. On the right, elementary school version. You could implement these from kids from ages, 8 all the way up to 18. That's what we've got, and these are the the visuals of the 2021 versions. You can tell they're the latest version because they have that different colored strip underneath the illustration. That highlights the fact that they're 2021 version. Also, here's our vaping. This is our e-cigarette Prevention Plus Wellness program. Again, to the left, high school, in the middle school, and then to the right, the elementary school version of the vaping PPW program. And then we've got the opioid PPW program. What you're looking at there is a cover of the adolescent version. It's been updated for this year. We have two other versions of the opioid PPW program, one for high-risk young men and another for high-risk young women, but we'll be focusing on the adolescent version of the opioid PPW program today. So here you go. Here is a brief overview of all of these Prevention Plus Wellness programs. All of these programs we're discussing today, we call them evidence-informed Because they've not been evaluated rigorously like our sport, which is our alcohol drug prevention plus wellness program for youth, or our in shape alcohol drug PPW program for young adults. That said, all of these programs today, marijuana, vaping, opioid PPW programs, are all based on an evidence-based practices, screening, and brief intervention. Now, the difference between these three programs we're talking about today, marijuana and vaping PPW programs, those two are based on the sport program. That's the evidence-based sport program. The opioid PPW program is based on the evidence-based in shape program. So I'm going to highlight those differences. And what we're going to do is we're going to look at different versions of these programs. We're going to focus on the marijuana high school version, the vaping middle school version, just so you can see the difference between high school and middle school. And again, remember, these two programs are adapted from the sport PPW program. So they represent the sport content to a certain extent, and the shape and format. And then the opioid PPW program is based on the in shape program. So all of these programs today we're talking about, they might target e-cigarettes or obviously cannabis or opioids, but all of them also promote physical activity, healthy breakfast and nutrition, sleep and stress control to different degrees. Under number 4, all of them are evidence-based practices, screening and brief intervention. You got a whole bunch of very important organizations and agencies throughout the world that have identified screening and brief interventions as evidence-based practice, from the World Health Organization to SAMHSA, Substance Abuse Mental Health Services Administration, NIDA, National Institute of Drug Abuse, NIAAA, National Institute of Alcohol Abuse and Alcoholism, the American Academy of Pediatrics, and others have identified screening and brief interventions as evidence-based practices. All PPW programs use this evidence-based practice format. They come with slides. Your program comes with slides, which you could show to your youth. You have in your manual, you have a script to implement your programs to youth individually or in a group. Also, we now have protocols and tools to provide them very easily and adapted them to use online, live, and then it comes with a digital download of your slides and all of your reproducible materials. So it's a single purchase program, and the more you implement it, the less it is per youth. So it's very, very cost effective. All PPW programs are based on the behavior image model. This is a marketing related conceptual framework which emphasizes the importance of focusing on positive images to motivate youth to set goals. And of course, that goal setting, very important to behavior change. That's what these programs are all about. It's about changing youth behaviors in a holistic way. These are all integrated programs, integrating multiple risk factors for youth health and well-being, not just substance use, but also these other chronic disease risks of being physically inactive, unhealthy nutrition, not adequate sleep. All of that is addressed in a single session program, prevention plus wellness programs. So all the programs we're talking about, marijuana, vaping, opioid PPW programs, all have these 7 sections, these 7 chapters in the program. So you can see you got introduction, you got step-by-step directions for implementation. But remember, we also offer 2-hour live program implementer training, and we offer 2-hour live training of trainers, so you could train others to implement these programs in your organization or your region. Section 3, screening survey and goal plan. That's part of the intervention. I'll describe that in a minute. You've got a script to provide your programs to youth individually as well as in a group. And by the way, all these prevention plus wellness programs are universal prevention interventions. They're made for all youth, but many organizations will provide them to high-risk youth. And we do have some data that suggests that they may even be more effective for already substance using youth. Section 6 has your built-in evaluation tools, which includes a pre-post survey to assess how well you are doing with your program, with your youth, your young adults, as well as process evaluation tools. And lastly, you even have a tool under number 7 to continue the process, to continue that self-regulation goal setting piece with that follow-up goal plan, which is an online goal plan. And you could have it you have a link to that, and you can continue to provide feedback to youth on their goal setting beyond your single session prevention plus wellness program. Now, all PPW programs follow this 3-step evidence-based SBI, that screening brief intervention process. So this is really important to understanding prevention plus wellness programs. So let me highlight it for you. The 3-step process is step number 1, you screen youth for their current health habits. That includes substance use. Obviously, if it's the marijuana PPW program, the substance use is going to be cannabis. If it's vaping PPW, it's going to be e-cigarettes. If it's sport PPW, it's going to be alcohol, and so on. So you screen youth for their current health habits, their substance use, and their protective wellness behaviors: physical activity, nutrition, breakfast, and nutrition, sleep, and even stress control. So this is designed to increase youth awareness of their health habits. That's step 1. Step 2, you provide feedback on those healthy behaviors. Each one of those behaviors, you can provide feedback. Positive images are going to be provided, positive image terms that are designed to cue or trigger future desired images of youth, of themselves in the future: healthy, fit, successful, active, athletic, etc. And these are highly motivating unconscious images that will increase motivation for change, to the extent that those future images of themselves, which, by the way, we all want, not just for our youth and for our youth, but for ourselves, that this will increase motivation to change their behaviors as a value for them. And if, to the extent that those are values, they will be motivated to then, step 3, set goals, not just to avoid substance use, but to improve protective wellness behavior. So multi-behavior goal setting is unique to prevention plus wellness. Okay, that's the 3 steps. Now, here are what your programs include. Now, we covered this last week when we discussed the sport prevention plus wellness programs, high school, middle school, elementary school, that focuses on alcohol. But nonetheless, if you missed that, let's go through this very quickly. And this is these are in your program manuals. If you purchase any PPW programs, but you can see what they're included. You get directions, you've got your screening survey, your brief self-administered youth, sometimes called health and fitness behavior screening survey. You get scripts to provide your program to youth individually or in a group. You get your colorful PowerPoint slides, which highlight the key image terms and other benefits, how substance use, whether it be cannabis or e-cigarettes or opioids or alcohol, interfere with those positive behaviors and images and benefits, and illustrations in those PowerPoint slides, which show positive models or representations of youth. That's you get a hard copy and an optional goal plan slides for your goal plan. In other words, you get 2 versions of the goal plan. A little bit more about that later. You get a scannable and optional online pre and post test to assess immediate effectiveness and fidelity of implementation. You get an instructor survey. That's a process measure. You complete that, and that assesses, or you assess your own quality of presentation and implementation. You get a fidelity checklist. And then you get a link to online follow-up goal plans if you want to continue to have your youth continue that process of setting goals week after week to develop self-regulation skills or be able to shape their own behaviors. Online resources are all part of all PPW programs, as well as phone and email support. Lastly, we do have online 2-hour program implementer and training of trainer workshops.
So what does your program include? So this is it. That was it actually. What are the steps for implementing your program? They're right here. You could just follow them. Just go through them with you very quickly. Practicing is step number one. You want to practice your script. Even before that, if you can take the online 2-hour program implementer training, that's really important to helping understand how to best implement your program. Excuse me. So after you get your training, if you get training, after you practice your script, you may want to alter or to tailor your program slides. That's where we come in. We ask, and during our training, we discuss this a little bit more, your options for co-branding or tailoring your slides. And we work with you to do that, to make sure your program does meet the needs and represents the youth that you're working with. You then, under number 3, make copies of your screening survey, your goal plan, your optional pre-post test, from your digital download. So all of your reproducible materials are right there. You just make copies. You don't have to purchase anything else. Then, before you begin your lesson, if you so choose, you implement your pre-test, either in a scannable form or an online link form, and then you launch your lesson. And how do you do that? You follow your script, you show your slides. When done, you walk you through that goal plan. And then lastly, you provide that scannable or online post test, all done within a very brief period of time, within one session, depending on how much interaction, how much time you spend with youth. With a goal plan, it could be anywhere from 40, 45 minutes to an hour, and you can extend it obviously beyond that. Continuing your steps for implementation, you're going to remind your participants to monitor their goals, to post them and monitor them every day of the week. And then you could re-implement your Prevention Plus Wellness program every 6 to 12 months as a reminder, as a booster. You then, as an instructor, complete your instructor survey to self-assess how well you presented your lesson at that time. You can complete a fidelity checklist every month or so. And then if you collected scannable pre-post tests, you simply put one on top of the other, pre-test on top of post-test, scan them in any printer scanner, and send us a PDF of your scan forms, and we have the software. We'll run a free analysis for you. If you collected your pre-post test data on the link, the SurveyMonkey link, we'll send you the data, the raw data, as well as the SurveyMonkey charts of your pre and your post test data. All that data is yours, and it will inform you and help you promote your program and improve your program over time. Don't forget, do go to our website, preventionpluswellness.com, and sign up. Just drop in your email so that you'll receive weekly email blasts of our free webinars and other resources. So those are the steps for implementing whatever program you've got. Now, let's start looking at the content and the slides of these 3 programs. Let's compare them, contrast them. Let's see what they look like and how they are similar and different. So let's start with the marijuana PBW program. This is a high school version, and this is the group feedback. So now what you're going to do is, this is your introduction, as you can see there. So to the right, you see the actual script. You're provided a script. You practice your script, and then becomes second nature. And so when you implement this to your youth, one-on-one or in a group, in person or online, you could look your youth in the eye, or in this case, if you're presenting it live online, like on Zoom or Microsoft or whatever platform, you could look at your camera and you could say hello for the next several minutes. I'll be talking about this exciting new health and fitness program. And together, what we're going to do is look at your habits that can make you look better, feel better, and improve your performance, not just in physical activities, but school and relationships. So that's how you do it. You present it, it's a script. You follow the script, you practice the script. Very, very simple, very efficient. Now let's take a look at the vaping PPW program, middle school version we're looking at now. Remember,
the marijuana. We were looking at a high school version. These are adaptations of the sport PPW program. This is the introduction. You can see the introduction to the right, very similar to the high school marijuana. You say hello. It's just an introduction. You're just getting the youth primed and informed as to what's coming up. And you can expand these introductions if you want to. Here's the opioid PPW program for adolescents. Introduction, a little bit different because remember this program is adapted from the InShape program versus the marijuana and the vaping PPW programs are adapted from the sport program. So you can see the introduction, a little bit different, but more similar than different. You're welcoming them. You're going to introduce them to the program and tell them what they're going to get in the next hour or so. So that's an introduction. So you have an introduction. That's the first part of the implementation. The next part is you're going to walk you through the screening survey. Remember, that's the first part of the three-step process of providing screening and brief interventions that are prevention plus wellness, screening, feedback, goal setting. So the first part is screening. Here is the script that you can read to your youth. You'll practice it. It'll become second nature. You'll be able to focus on youth and really just glance down at your manual and look at your youth and say, now, please take out your copy of the, and again, this is for the high school marijuana, the middle school vaping. They're more similar than different. So that's why we're just showing one version. Take out your copy of the Prevention Plus Wellness Health and Fitness Screening Survey. The purpose to determine what you're doing about your health. And then you sort of highlight the importance of answering honestly. Don't put your name on the survey. And then in parentheses now, these are directions for you as the instructor. All of this is in your script, in your manual. Wait until everyone completes the survey and then show your slides. So really, it's a beautiful thing. It's all laid out. It's very simple. And you just follow the script and you practice the script. And you practice in whatever format you're going to be implementing. If it's going to be one-on-one, if it's going to be in person, if it's going to be online to a group, whatever, practice in that format so you're comfortable with that format. So that's the screening survey, but here's the screening survey for the opioid PBW program. Again, it's more similar than different. You read the script. Now, this is obviously the script if you're implementing this to youth in person. Okay, so what about online? We'll be talking about that here in a minute. Screening survey items. I just want to show you what your items are for a screening survey across these three programs: marijuana high school, vaping middle school, and opioid adolescents. So if we're taking a look, let's take a look at the marijuana high school. Here are the measures on the screening survey: physical activity last year, regular physical activity norms, breakfast, nutrition, sleep, 8 hours. And obviously, because this is the marijuana program, we got a measure of marijuana, ever using marijuana. Now, the two items that are highlighted, physical activity norms and ever using marijuana, are specific to this program. Okay, so those are unique to the high school program and to the marijuana program. So for example, when we look at the screening survey items for the vaping marijuana middle school program, you can see that there's the same measures that are highlighted, that are not highlighted: physical activity last year, regular physical activity, breakfast, nutrition, sleep. The only different measure is ever using e-cigarettes. Okay, so you can see there's a little difference between the high school version and the middle school version of programs. A high school version addresses physical activity norms, and depending on the version you have, obviously middle school will address a measure of middle school in the screening survey. Vaping will address a measure of ever using e-cigarettes. How does that compare to the opioid PPW program for adolescents? Well, again, since the opioid program is based on InShape and the marijuana and vaping PPW programs are founded on sport, there's a little bit more of a difference. So the unique aspects or the unique measures of the opioid PPW program, you can see here, are measure of moderate physical activity, regular moderate physical activity, as well as regular vigorous physical activity or exercise, regular self-control, and of course, because this is an opioid PPW program, past 30-day non-medical opioid use. Other than that, healthy nutrition is about the same, sleep is about the same as in our other programs, including the vaping and marijuana program. Okay? Now, what are your options for implementing the screening survey? Let's say you're going to provide the screening survey to youth. What are your options for providing it to them in person and online? So if you're in person, you simply make a hard copy, you make copies of your hard copy for in-person presentation. You distribute it to your youth, and you make a copy from your digital download. Very simple. Your option for presenting your screening survey online, you have two options. Now, one is you could just show the slides, your PowerPoint slides, and you could add, and what you'll have is your screening survey questions will be on your slides, and you have youth who are watching virtually, you can have them complete the screening survey on a blank sheet of paper. That's one option. Option two for presentation online is now we're adding a link to a screening survey. It's in a document, a Microsoft document. So while you're presenting this slide, you could, as an option, you could have them click on that link, go to that screening survey document and complete it. So though you actually have two options when you present in person. And in fact, you can use these whether you're presenting this in person or online. It's just that when you present in person, you actually have a physical hard copy of the screening survey. And if you wish, you can make copies of it and you can distribute it. Okay? I hope that's clear. If it's not, ask me questions in your chat space and I'll circle back and answer that. Now, once you've collected and once you've walked you through the screening survey, that's for step one. Remember, screening survey, feedback, goal setting. Now let's talk about feedback. So let me give you an example of feedback. We're going to provide feedback on the screening survey question, the very first one in the marijuana and the vaping programs, sports and physical activity last year. Remember, that was the first screening survey question. Now let's follow the feedback. So this is the feedback, whether it be the marijuana or the vaping PPW program. And as you can see, there's your directions in parentheses for you as the instructor. You're going to show slides, and then you're going to ask the group to raise their hands and respond to each of those physical activities. There's a list of them. If they engage in any of those physical activities in the last year. And this is going to highlight a very positive norm that, hey, my peers, my friends are physically active. And there's going to be a slide that repeats the question, what sports, physical activities did you play in the last year? And then you'll go down the list. Who played any baseball or softball in the last 12 months, in the last year? Even if you threw a baseball or softball, raise your hands. And of course, if you're in person, you could have people raise their hand. If you're online and you could have a visual of every youth, you can have them literally raise their hands. You can have them give thumbs up. For most of the online platforms I've seen, you could click on the hand raise or the thumbs up. There's a lot of options in your platforms, even if you're presenting this online, to have your youth be engaged. You want them to answer to this question, and you want youth to see, oh, look at the hands are being raised about all these physical activities. Riding, did you ride a bicycle? Did you run or walk? Of course, you'll have all kinds of hands raised. Did you play any basketball last year? Don't have to be in a league. Even if you dribbled the basketball, even if you shot a basketball, give yourself credit for that, and you'll see lots of hands raised. And this is going to be, again, reinforcing a positive norm that my peers and my friends are physically active. Very, very good. Then you're going to continue the feedback following your script. This is the benefits of sports and physical activities last year. Show your slide. There you go. There's parentheses, giving you as an instructor, telling you what to do. Here's the content to the right, very similar marijuana or vaping. So I'm just going to show you some sample communications to the right. Good for you. Sports, physical activities are a great way to get regular exercise. They're fun. They help you look fit and strong. Very, very powerful image terms that evoke an unconscious image of themselves in the future. Who doesn't want to look fit and strong? Who doesn't want their youth to be fit and strong, healthy, successful, etc.? Give you lots of energy and can help you do better in school. So that's the feedback you're providing. The first part of the feedback, benefits of sports physical activity. It's going to be about the same, whether it's the marijuana program or the vaping program. Remember, these are adaptations of sport. Here's the difference. Here's the marijuana program. There's the content to the left, highlighting those key image terms and benefits: fit and strong, fun, energy, etc. There's an image to the right. This is the high school version. You want to show happy, healthy images of older adolescents engage in wellness behaviors, and we're talking about sports physical activity. You want youth to see representations of themselves. That's why in Prevention Plus Wellness programs, we have boys and girls, we have different ethnicities, different activities. And so this is the marijuana high school. This is the vaping middle school. The only difference, really, not much difference, is in terms of content and highlighting the benefits and images, but you do see, obviously, the illustration is different. You want to have these younger kids see younger kids so that they could see models of themselves. They could see themselves in these images. Now, the next part of this messaging, after you've highlighted the benefits of that wellness behavior, and that was the first screening survey behavior. Remember, sports physical activities last year. Now for the marijuana program, you're going to talk about how marijuana harms sports and physical activities. And there's the content to the right. However, marijuana and a healthy and an active lifestyle don't mix. Using marijuana could hurt your health, how well you do in sports, physical activities. Using cannabis can harm your brain development, lung function, increase your risk for mental health issues, and can hinder being a success in school and sport. See that linkage, how we link marijuana as being counterproductive, harmful, risky, for each one of those protective wellness behaviors that are in the screening survey and that you're providing feedback on. Then you show the slide. While you present that content, you show the slide. There's, again, this is for the visual learner to the left. You highlighting the most important things, how marijuana hurts brain development, lung function, success. And then again, you want to show some really great positive images to the right of young people. Here's how e-cigarettes, this is the vaping program. So this is a little bit different because obviously marijuana addresses how marijuana interferes with sports physical activity. And last year, vaping discusses how e-cigarettes, and you can see a little bit more content here. Nonetheless, you're going to show a slide and you're going to read the content. You're going to practice this. You're going to highlight how e-cigarettes like Juul can hurt and affect how well you do in exercise, sports, physical activities. And then there's discussion about nicotine and chemicals and how that can harm brain development, lead to attention deficit disorder, reduce lung function. Vapor includes harmful chemicals that can cause eventually lung disease. And then benzene from car exhaust, really, and heavy metals like nickel and tin. Really good content here. You're highlighting again how e-cigarettes interfere and harm this image and this very positive behavior of being physically active and fit. There's the very brief slide you're showing, but you're reading the script. And obviously here you're showing a little younger population because this is a middle school group. Now let's take a look at feedback from the opioid PPW program. Remember, the first screening survey question on the opioid PPW program was moderate physical activity. There's your script to the right. You show your slide, ask participants to answer to themselves. You can see it's a little bit different because, again, the format for the opioid PPW program is in shape. The format for the vaping and marijuana programs is sport. Most days of the week, do you engage in moderate physical activity for at least 30 minutes, such as fast walking, slow biking, skating, dancing, swimming? So you're going to repeat the question, you're going to show the slide while you repeat it, and then you're going to provide feedback. Benefits, first of all, benefits of moderate physical activity. There's the script to the right, and there's a bunch of content there. Very powerful image terms, energetic, and so on. And then the last bullet point, you're going to remind them 30 minutes moderate physical activity, keep you focused and help you work harder and smarter. Really good. and eases anxiety, mild depression. Really, really good content there. The benefits of modern physical activity. There's the slide you show. There's the images to the right. These are adolescents now. This is the adolescent opioid PPW program. A little bit more content. That's why you see a little bit more to the left about the benefits. And then now the script as to how opioid use interferes. So non-medical opioid use interferes with creating a physically active lifestyle. How? Gets in the way of setting fitness goals, causes drowsiness, mental fog, nausea, constipation. Really, really good content here. And so this is your script. This is what you practice. You can implement it, look at your youth and present this. And while you're doing that, you can show the slide, which is highlighting these key terms and images and benefits. And then you've got this great illustration as well of young people healthy and happy and so forth. So that's the feedback you're presenting. What other feedback are you going to be presenting in the marijuana and the vaping PPW programs? Well, each of the items that were assessed in the screening survey: regular physical activity, then physical activity norms for the high school version of the programs, breakfast and nutrition, getting adequate sleep, and depending on which program, either addressing cannabis or addressing e-cigarettes individually. Further feedback for opioid PPW program are the other screening survey questions: regular vigorous exercise, healthy nutrition, sleep, stress control, and then past 30-day opioid use. What are when we address the substance use topics, what are the additional topics? What are the topics within specifically the marijuana high school PPW program? These are the topics that are addressed within that portion of the program. Marijuana can harm your fitness and health, can cause life problems, myths. Most youth do not use marijuana. Very important social norm message: healthy alternatives, choose for yourself, plan ahead, recommendations for wellness. So this is the extra content. And by the way, those items that are highlighted, marijuana myths, choose for yourself, plan ahead, those are specific to high school version programs, PPW programs. So what does the vaping middle school program present in terms of content associated with vaping? Well, middle school programs a little less content than the high school programs, but still you can see, in this case, vaping e-cigarettes can cause harm for your fitness and health, cause life problems. Most youth do not vape cigarettes. That's a social norm message: healthy alternatives and recommendations for increasing wellness. And then the topics that are addressed within the heading of opioid use, specifically within the opioid PPW program, and you can see them here. And the unique ones are highlighted. You can see what they are: defining prescription opioids, signs of opioid overdose, treating opioid use disorder, opioid treatment and prevention are effective or that work. Those come really from SAMHSA, the Substance Abuse Mental Health Services Administration. They said this is important to address these in any kind of prevention intervention program. So that's why they're addressed in the opioid PPW program. Then you're going to highlight the benefits, or I should say, how to increase overall wellness. PPW programs are not just about avoiding substance use, but overall wellness and promoting health and well-being. And so you can see here, this is the marijuana high school version, not very similar to the vaping middle school version. Number 4, most importantly, avoid marijuana. Obviously, the vaping PPW program is going to say avoid e-cigarettes, but then other substances, alcohol, tobacco, etc., and increase or address these other wellness behaviors. Number 1, get plenty of sleep. 8 hours may be fine for some need 9 or 10 on a regular basis, especially during the school week when they have to think clear and have to be fresh and have to perform in school, in relationships, in physical activity and sport. Number 2, eat a healthy breakfast, plenty of healthy foods like fruits and vegetables. Number 3, lots of physical activity on a daily basis. That's fun, that's different. The opioid wellness, how to improve, increase wellness, will address whatever the screening survey questions were. So really, your PPW programs follow the screening survey questions and those behaviors throughout. You screen youth for those health behaviors, you provide feedback on those health behaviors, you ask young people to consider those health behaviors, all of them, in their to improve their overall wellness. So for the opioid PPW program, we're asking them to get at least 30 minutes of moderate physical activity every day, 20 minutes of vigorous exercise, take steps daily to implement stress relaxation. Number 4, eat a variety of healthy, nutrient-dense foods. That's a concept that's just in the opioid PPW program and in shape. Getting plenty of sleep, and most importantly, obviously, to your fitness goals, avoid non-medical prescription opioids, illegal opioid use, as well as other illegal drugs, etc. So those are your instructions for overall wellness that are provided to youth. That sort of integrates everything at the end of your feedback. Throughout your lesson, you'll have these discussion questions which is designed to elicit feedback and interaction, especially when you're presenting in a group setting, in person or online, really important. But even more important, to continually bring this back and have you think about their own lifestyle. What types of healthy foods do you like to eat, or would you like to eat more of? And really, we want young people, because they lack eating breakfast, because they lack eating fruits and vegetables. Those are really, really important. Then step 3, goal plan. Here you want them to complete a goal plan. Prevention Plus Wellness goal plans have recommendations for wellness. You can see the 6 components here: pledging to avoid e-cigarettes or cannabis or opioid or whatever, writing a measurable health wellness behavior goal, signing and co-signing it to increase that motivation for change, monitoring their goals for the next 7 days, posting their goals, tracking their behavior for the next 7 days. Research shows if they are successful in those 7 days, that will lead to success in the future. And then congratulations and instructions and motivational feedback to help them continue that process of weekly setting goals and developing their self-regulation skills to set, monitor, and achieve behavior change in their life. Now, what are the options for goal setting? Sort of like the screening survey question. Options. You have options for goal setting as well. If you're in person, you can simply make copies of your goal plan, the hard copy that's in your digital download, and you can distribute and have everybody complete a goal plan, and you can walk them through and help them. If you're presenting your lesson virtually, like we're doing today, you simply show your PowerPoint slides. There's a goal plan instructions in your slides, and you can have youth complete a goal plan on a blank sheet of paper. That's one option. Another option is we're integrating right now a link to a goal plan document, and you can have your youth click on that link, and you can walk them through the goal plan. And then lastly, we even have a link to a follow-up goal plan to continue the process of goal setting. So you have a number of options for goal planning to allow you to have your youth set goals, whether you're presenting your marijuana, your opioid, your vaping, your sport, whatever PPW program, online or in person. Very, very easy. Now, what happens if you present your lesson in person? One-on-one, I should say one-on-one, whether in person or online. What we looked at is the group script. If you're presenting your lesson to 2 or more youth, well, we have an individual script. This is very powerful because it's tailored to how your youth answered each one of the screening survey questions. So let's just look at, as an example, the marijuana high school version. This is the individual feedback. So if you present this to one youth at a time in person or online, you practice the individual script, not the group script, and then you read the individual script. So here's the feedback. Just one example. Let's say we're providing feedback to one youth on the question of marijuana use, whether they answered yes, they tried marijuana in the last year. You read only one response. So you have two options here. You read the green response, which is green, good, go. Your youth said, no, I didn't use marijuana. I've never used marijuana. Or you read the the yes response in this case. Yes is, in this case, red, warning, high risk. So what's the difference? Well, with the green response, your youth said, no, they didn't use marijuana ever. You read, well, it looks like you've not tried marijuana. That's terrific. So you're providing them positive feedback. If they said they didn't use marijuana, you read that response. It says, it looks like you may have tried marijuana. An active life and cannabis do not mix. Most important thing you do to be healthy, maintain an active life, stay away from all marijuana. So the feedback is either positive or neutral. No negative feedback, because we don't want to tune anybody out from listening to us. So that's the difference with the individual script. It's customized to how each youth answered the screening survey questions. Other than that, the content is pretty much the same. Use the same slides. You're going to highlight the benefits and images of the healthy behaviors. You're going to show how the substance use behaviors interfere and harm those. Give you one more example: fitness, breakfast and nutrition. This is the middle school version of vaping. If your youth said yes, they eat a regular healthy breakfast, you read the yes response. That's green, and that's green, good, go. Looks like you're eating a healthy breakfast most mornings. Wonderful. Eating a healthy breakfast every day can have a big effect on how you feel, have more energy, etc. But if they said no, they don't eat a healthy breakfast every day of the week, then you read, looks like you may not be eating a healthy breakfast. Try eating a healthy breakfast every day. So that's the difference. That's the difference with the individual script. It's individually tailored. Now, what are some directions for you implementing your program, specifically directions for implementing your program online? Here they are. When it comes to pre-test, that's your optional pre-test and post-test. You can provide your pre-test in a scannable form. If you're in person, not a problem. If you're online, you show your pre-test link in the chat space. You tell your youth to click on it, you wait a couple of minutes, and then you launch your lesson. You've collected your pre-test virtually. Very, very easy. Those are your options and instructions for collecting a pre-test. How about your options for screening survey? We've already talked about these. If you're in person, you make copies of your screening survey, you distribute them, but we also have a link in the slides. And so you can have them click on that and complete it virtually. Or you could show the slides, which show the screening survey questions, and you can have them write their answers on a blank sheet of paper. So you got a couple of options there. When it comes to goal plan, same thing. You can make a hard copy of the goal plan, or you can have them follow the goal plan slides and complete a goal plan on a blank sheet of paper, or you can have them click on a link and complete a document online. Post-test, same thing as the pre-test. You got a scannable pre-test and post-test, but you also have a link to the post-test. You show your post-test link, tell your youth who are online by Zoom, by Microsoft, by whatever platform, have them click on it, complete it in a couple of minutes, and then you're done. You've completed and you've collected your pre-post test. Very, very simple, very powerful. We have evaluation materials, pre-post surveys. There's the survey. We talked about this a little bit more last week when we talked about the sport PPW program. You've got measures of behavioral intentions, which is the most highly predictive measure of future behavior, and perceived harmfulness. Both of those measures are in your pre-test and post-test, identical measures, so you can see if there's change from pre to post, before your lesson and after your lesson. And then post-test also has two very important qualitative open-ended items where you get feedback from youth in their own words. Very important for you to promote your program and to improve your program over time. So that's your pre-test, post-test. Your instructor survey, that's your self-assessment, includes 7 items, and you will be able to assess how well you presented your lesson, because you should complete this instructor survey every week, or at least every week, if not every time after you implement your program, your PPW program, that will track and help you keep in mind what's important when you present this lesson. Now, we have a bunch of training opportunities. Well, we have some training opportunities. We have free webinars every week. Do go to our website, preventionpluswellness.com, and drop in your email so that you get notified of those. We have, as I had mentioned earlier, we have got a 2-hour online program, a live program implementer training, a 2-hour online train the trainer, and we do training in person. Not so much now with COVID, but we do train others as trainers, and then those trainers can implement in person in your region or locale. Brand new, coming up. Stay tuned for this. You're going to want to know about this. We're creating Prevention Plus Wellness programs in another virtual format. In addition to you presenting your PPW programs live, we're going to create video versions of these programs with fantastic, active, positive imagery of young people being physically active, engaging in physical activity and sports and nutrition and sleep and stress control. All of that, along with the content, along with the script, will all be available for you. And that will be an interactive video that we're creating. So we're creating these interactive videos, starting with the sport PPW program high school, but eventually, if these are something that you want, if these are something that you can see yourself using, because you can send the link. And for those of you having problems getting into organizations, schools, boys and girls clubs, whatever, you could send the link to existing teachers, they could show it, and so your youth will be able to have an intervention and save you a lot of time as a prevention and health specialist. These are all of our programs. I just wanted to list them all. We have 5 of them, 3 versions of sport, 3 of vaping, 3 of marijuana, PPW, 1 in shape for young adults, which is being implemented, by the way, in colleges and communities and U.S. military, 3 versions of opioid and racial justice PPW, and 3 versions of sport PPW, high school, middle school, and elementary school. Sport PPW, by the way, 2 is our only 6-session prevention, multi-session prevention plus wellness program. There's our website, preventionpluswellness.com. Go there, drop in your email, and you'll be notified weekly of our free webinars and other content available. preventionpluswellness.com. Email me anytime, info@preventionpluswellness.com, or you could call us 904-472-5022 here in St. Augustine, Florida. Thank you so much. So I'm going to pause now. I'm going to see if you have any questions, any comments. Was there anything unclear? Do you need me to say anything else about some of these things we discussed? I went through a lot of slides. I'll be sending you a PDF of these slides. I'll be sending you a link to this recorded session. No worries there. I'll be sending you a certificate for 1-hour CEUs for participating in this training. So thank you, Andrew. Thank you very much for thanking me, and I thank you for being here. God bless you all for what you do, making a difference. You're the true heroes, prevention and wellness heroes, making a difference, and especially during this very, very challenging time where you have to protect yourselves and your family and also do your jobs of providing essential evidence-based content and tools to youth in your communities, your regions, your states, your nations. So thank you so much for making a difference in the lives of youth and families in our country, in our states, and in nations across the country. So let me see, I'm going to go through this and see if anybody has any questions. A bunch of people said good morning. Good morning to everyone. Sound seems to go in and out. That seems to be a case. I don't know. Some people have problems with sound and others not. I don't know what that's about. There's my friend from Ecuador. Hello to him. I don't know what that volume thing is doing. Hopefully the recorded session will be fine. Thank you very much. Very informative. Thank you. Lots of thank yous, and I thank you back. Here we go. Here's a question from Heather. Do you have any information on how effective these programs are? What kind of outcomes have you seen? So that's a very good question, Heather. So we do know that screening and brief interventions are effective. That's why they're evidence-based practices. And all of these programs are evidence-based practices. We do know specifically our sport and in-shape prevention plus wellness programs, which address largely alcohol, have been effective in preventing not just alcohol, but marijuana for sport, tobacco, improving healthy behaviors like physical activity. Those have been evaluated. We do know that we are getting some very positive results for those allowing their youth to complete the pre-test and post-test. So that's what we do know. We do know that these programs, because they link multiple behaviors, are likely to have an impact on multiple behaviors. And even if they only address one substance, like sport addresses alcohol, we found that sport also has a positive influence on tobacco and marijuana and physical activity. So by linking these different substances and by showing how one substance interferes with wellness behaviors, I think youth are making the connection that other substances also interfere. But you have built-in pre and post testing so you can evaluate your program effects yourself. So hopefully I've answered that for you, Heather. That's the best I can do at this point. Thank you for the time. Found it to be a great webinar. Thank you for sharing. Great information. Thank you guys. God bless you guys. Thank you all. Nice, thanks. And let me see, go back to Q&A. We've got a couple. Is there a fee for these programs? So yes, there's a fee for the program. The program manuals with digital download for most of our programs are $4.99. That's a one-time cost per program. And then you can implement that to countless youth. And the more you implement it to youth, the less it becomes per use. So it becomes pennies per use. So it becomes very cost effective. We also have 2-hour online training for $1.99 per implementer. Have to run to another webinar. Thanks for joining us, Andrew. I appreciate that. Thanks for that question. See if there's any other comments. I don't see any others, so I'm just going to say again, thank you for joining us. Thanks for all you do. If you need anything, reach out to us, preventionpluswellness.com. Keep up the good work. Stay safe, stay healthy. And again, it's been an honor and a blessing for me to spend time with my heroes, my personal heroes, prevention and wellness specialists from throughout the world. Have a great afternoon, everyone. Stay safe, take care, stay in touch. Thank you.